Chronic cough, the cough that's been with you for weeks, months, or sometimes even years. As a GP, I see two types of people with a chronic cough. You've got the person who goes to the GP time after time, antibiotic after antibiotic, test after test, and treatment after treatment, and get nowhere. And then more concerning to me is the second type of patient, the one who sees their cough as a bother. They don't want to trouble the GP and waste the doctor's time with this, and they see it almost as an embarrassment. But eventually these coughs can lead to big problems ranging from social isolation and embarrassment all the way up to depression and anxiety, and even the associated rib pain and reflux that might come with it, and the associated lack of sleep and all the problems that come with that. Sadly, both these type of people end up just accepting this cough as a part of life. I'm here to tell you, you don't need to accept it. And I'm not going to waste your time telling you a cold can cause a cough. You already know that. Instead, I'm going to talk about the hidden causes of a chronic cough that your doctor should have thought of. Then I'm going to go into the hidden causes of a cough that your doctor might not have thought of. And finally, I'm going to talk about a natural remedy and a simple technique that might just be better than anything you've heard of or tried before. Now, although a lot of what I talk about today applies to people who've had a cough for more than 3 weeks, a chronic cough by definition is a cough that lasts more than 8 weeks. But before I get into the nitty-gritty of it, I need you to have a look through this list of symptoms here, because these are potential red flags for something more serious or nasty that might be going on. So if these do apply to you, make sure you talk to your doctor urgently. So let's start with the obvious hidden reasons, starting with airway disease. Now, this includes diseases like asthma, COPD, bronchiectasis, conditions that cause inflammation of our airways that leads to narrowing of those tubes that can, as a result, cause a cough. But they tend to come with other symptoms as well, and not just a cough, like breathlessness, especially on exertion, or wheeze. Now, the tests to do to help diagnose whether that's the problem are spirometry and a chest x-ray. These are two tests that should be considered in everyone who has a chronic cough. But another mode of attack might be to trial a treatment, which would be a trial of a steroid inhaler to see if that helps. This is where the acidic stomach contents make its way up the chest to the cough center at the back of the throat, triggering a cough. Now, usually this acid reflux will give you indigestion and reflux type of symptoms, often associated with eating or especially lying flat, as the acid can then trickle up towards the back of your throat. But there is such a thing as silent reflux as well, where you don't actually feel any of that. And actually, you go to the doctor with just a cough. And acid reflux is super duper common. Now, a way of diagnosing it, one way is to stick a camera down and to have a look. But what I would say is a nicer way to diagnose it is to see if you can make it better. And by that, I mean treating you with acid suppressants. Now, that might be as simple as Gaviscon and Reni, that just sort of form a coating over the acid and neutralize it a little bit. But more often than not, to go full out with a medicine like omeprazole or a trial of it to see if that helps. Runny noses can happen with allergies or viruses or sinus issues, and runny noses don't have to just come out this way, especially if you lie back flat. So overnight, for example, it will flow down the other way and give you what we call a postnasal drip. Now, that can irritate the back of the airways too, and give you what is probably more of a phlegmy cough with a runny nose. And the best way to approach that is probably to just try treatment as well, which is usually with a steroid spray into your nose for the guts of 4 weeks. Sleep apnea is an important, woefully underdiagnosed, common condition where overnight the pressure on your airways as you lie flat causes the airways up here to actually narrow, and partners often complain that the person snores a lot and they have to sleep in the other room because of it. Or they even see episodes where they stop breathing and have to choke for air. Now, to the person with sleep apnea, they might feel they get a good night's sleep. But get this, they can wake up as many as 100 times overnight. Nonetheless, it leaves the person feeling absolutely shattered throughout the day. And the way to diagnose it is partially through doing a sleep diary, but also through getting sleep studies. As the heart muscle gets older, it can get weaker, and this can lead to a back pressure of fluid onto your lungs and cause a cough. Usually heart failure will give you other symptoms too, though, like shortness of breath, especially when you exert yourself, but also when you lie down flat. Some people with heart failure also get a lot of swelling of their ankles. Now, the initial way to look for heart failure is actually through a blood test called BNP. Now, sometimes medications can cause more harm than good, can't they? And probably the most notorious tablets for leading to a chronic cough are in the family called ACE inhibitors. And these include medicines like ramipril, enalapril, anything that ends in pril really, that's given mainly for heart failure, kidney failure, but also given for high blood pressure. Now, stopping the tablet leads to the cough getting better, but it can take well over a month. It can take several months for it to actually settle. There are other tablets that are associated with a chronic cough, albeit less commonly, and they include beta blockers, aspirin, NSAIDs like ibuprofen and naproxen, amiodarone, methotrexate, and even statins. There is one last very important, very common cause, and that is no cause. Think of it like this. Your body has a natural reflex to cough whenever the airway is irritated, and that might be with smoke or dust or viruses or just food or water going down the wrong tube, and it's useful to protect the lungs. But then when the irritant is gone, the cough should be gone as well. But for some people, the nerves in that cough center become overly sensitive and continue to fire. It's like having a smoke alarm that goes off whenever you're cooking toast rather than when there's a fire, if that makes any sense. The frustrating part, there is no obvious cure for this, but don't despair. I do have some good ways that you can get that cough under control, both naturally and through techniques. Let's start with probably the most simple one. Now, with a basic understanding of coughs, next time you feel like you need to cough, do this. Swallow. I know it sounds crazy, but as simple and all as it is, it often does actually work. And by triggering a swallow, you can almost trick your brain into thinking you've triggered a cough, but you've actually suppressed it. So this is how you do it. At the first sign of a tickle, or as soon as you cough, or you feel that you're about to cough, put your hand over your mouth. Then swallow once. Then hold your breath for a few seconds. When you start breathing again, take slow, smooth breaths for at least 30 seconds while keeping your hand over your mouth. Then tell yourself that you are not going to cough. And finally, take a smooth, normal-sized breath through your nose and take your hand away from your mouth. Now, I've spent most of the time in this video going through why you cough, with only one solution to stop your cough. There are multiple other evidence-based techniques that I'm aware of, as well as multiple medications to help, as well as herbal natural remedies that can help too, that I haven't had time to go through fully in this video, which is why I've made this video just here. Go and have a look at it. I'm sure you're going to find something that works well for you, but thank you so much for watching today, and I'll see you again soon.